So in terms of what's happening, I said in my opening remarks that we knew that there would be a large wave of Omicron. We knew that it was less severe, but there would be a small proportion that have severe disease and require hospitalisation. I think, as I said before, the vast majority of people are mild and can be cared for at home. Those that are going to hospital, that is a challenge, and we're taking on that challenge in terms of the workforce planning, the private hospital guarantee, and so forth that was mentioned by the minister. But this is a balance. There was envisaged that there would be cases, and some of those would be severe when the national reopening plan was announced and agreed at National Cabinet, and we're coping with that along the parameters that we have, using the levers we have in terms of control, as well as dealing with those severe end of the spectrum.
Great. Front and centre, please.
Thank you. To both the Minister and the Chief Medical Officer, the Victorian Nurses Federation says it's time to call in the Army. They say it's time to call in the Defence Force. They're at absolute maximum capacity. Why won't you do that? They are the experts. That's what they say is needed.
We're invoking the private hospitals agreement, and the nurses, doctors, support staff in private hospitals are clinical experts. And around the country, there are 57,000 nurses in private hospitals, over 100,000 staff. And they are clinically trained, they are expert. Matters in relation to the ADF are obviously a matter for the Prime Minister. But let me be very clear that the people that have the capacity to step straight into a hospital environment, those that have the training, the expertise, the skills, the knowledge, the history, are the nurses, doctors and care staff within the private hospital system. And we prepared for this moment, and there are 57,000 nurses, doctors, 57,000 nurses and over 100,000 staff within the private health and hospital system that are available on that front.
So if they're now saying the Defence Force is needed, I think they're aware that the private system also has that capacity. They say more is needed.
Well, at this stage, there is enormous capacity as yet unutilised, which can be drawn upon in the private health system. So we monitor, we maintain that, and I think certainly the skill set of a nurse coming from a major private hospital, whether it's the emergency ward, whether it's a frontline triage role, whether it's any of the important roles, is exactly the set of skills that one would want in a COVID ward or in a public hospital. And the states and territories are drawing upon this. So there's more that can be done that way, and using hospital staff to help support hospitals is obviously the safest, most important and most readily available resource. Next, please.
Jonathan Lee, Sky News. Firstly and foremost, where are we at with Novavax? We've been talking about it for months. Is it almost approved? There's 51 million doses. I suppose if Australia doesn't need it, perhaps the Pacific Islands could use it. And if we can be reinfected with COVID, as the Prime Minister said the other day, how do we know that we're not going to see a similar wave come wintertime?
Sure. Look, I'll take the first question and Professor Kelly can take the second. In terms of Novavax, the TGA is now at advanced stages of consideration. They've only just received the final data, and I'm hopeful that that will be very promising. I'm speaking with the company again in the coming days to ensure that we have those early supplies were there a TGA and a TARGI approval. That should help. I'm hopeful that we would see over 1% of people who have not yet had their vaccination. There are only 5% that have not yet had their vaccination, but that this would help with at least 1% of those. If that's 200,000 Australians who, for whatever reason, have chosen not to be vaccinated but feel more comfortable, then that will have been significant. And those doses that we don't use, we will absolutely share with our Pacific neighbours. So I'm very hopeful that we will hear more from the TGA over the course of the coming 10 days on that front.